Hi, good evening. Myself, Dr. Junaid. I'm working at a Muzaffarnagar. It's in UP, nearby to Delhi. I've done my MBBS and diploma cardiology from Indore. So basically, I'm working as a non-invasive cardiology. Today is a World Heart Day. We have all have to take care of the heart because it's like a burden on a huge community. So we have to take care of it. So let's talk about hypertension. Like it's a major cause of the mortality, as the people don't aware of the pros and pros of the cons of the hypertension. So understanding about the hypertension. So today discussion will be what will be high blood pressure and how to prevent it. So as these days, like generally everyone would like to have healthy and normal blood pressure, but exactly what does it mean? Like what do you mean by the normal blood pressure? How can you know that your blood pressure is within normal limit or it's about normal? So basically each time the heartbeat, what does mean by the blood pressure? Basically each time when the heartbeat, it pump blood into the blood vessels, it create pressure against the wall of the blood vessels. That's called a blood pressure. Normally in healthy person, it's rise and fall through the day. Like some people usually when go for a blood pressure, usually there are fluctuation of blood pressure. Sometimes it's high, sometimes it's low. So, but when the blood pressure remains high for a longer time and it's remain untreated, it can lead to a serious health complication. In general, persistent increase in blood pressure higher than a normal blood pressure is normal is also known as hypertension. High blood pressure usually develop over time. As the age increases, it usually causes a blood pressure. It can happen because of unhealthy lifestyle choices. For example, like these days, people think not going for a regular activities, obesity, smoking, and high alcohol consumption. Along with that, the major like the things which co contribute in that is stress and etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As the people got older, normally the arteries get stiff and narrow, and it get narrowed, and there's an excess fat accumulation in the arteries that causes a narrowing of the arteries. Other than that, family history of a high blood pressure. One or more close family members with hypertension increases person developing the condition. It's like it's in sibling, then it's going to create more problem for that. Excess salt intake is also known to increase the high blood pressure. In salt, mainly the sodium. Not eating enough food with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed food, fatty food, that increases fat throughout the body and make the heart work harder to push the blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to the obesity and further to high blood pressure. Another one is stress. Reacting to stress in an unhealthy way or not managing stress can also increase the high blood pressure. Moving on, hypertension does not have any obvious sign or symptoms, which is often called a silent killer. As a patient presented in the OPD, there's a like we can look out that the blood pressure is nearly 180, even the patient don't having any signs or symptoms. Like whenever we go for like when we measure the blood pressure, then it's come high, and the patient is not complaining for any symptoms. It puts people to several other risks. Measuring, measuring the blood pressure is the only way to know whether person is having high blood pressure or not. Like a patient present in the OPD, normally we go for a measurement or taking a BP and it causes a high. Sometimes a patient present with some symptoms like morning headedness or tiredness, vision changes, buzzing in the ears, fatigue, nausea, vomiting, and even sometimes also like a burning micturition when there's a and the oliguria, like when there's decrease in urine output. Fortunately, high blood pressure can be easily diagnosed. Like your blood pressure is one of the easiest and simplest diagnostic tool which can tell one so much about their current and future health. It is usually more measured with a instrument called sphygmomanometer. Now these days, automatic sphygmometer or electric sphygmometer are also available. in the market. So one should always keep that and should monitor their blood pressure. A healthy normal blood pressure should be lower than 120 by 80, or it can also be read as 120 over 80 mmHg. Here, the upper number indicates the systolic blood pressure, means the blood pressure when the heart contracts, whereas the lower number indicates the diastolic blood pressure, means the pressure in the blood vessels when the heart rests between beats. So it's like, it's so usually rule out that it's a combination of both the things. One, the heart contracts, and other the like vessel walls, the contraction of the vessels. In blood pressure, if blood pressure level is over more than 140/90, the person is came to know that he is a hypertensive, and there is a high risk of developing serious heart disease. To control the blood pressure, one should be advised before, first of all, lifestyle modification is the must, in which there should be a regular exercise, at least 25 to 30 minutes, 5 times a week. So one should always go for that. Along with that, healthy diets. One should control quit smoking, reduce alcohol intake, regular blood pressure monitoring, stress management, and the most important thing is the adherence to the medication. If the blood pressure is successful controlled with such lifestyle medications, then it might avoid delay or reduce the need for medication. So first of all, you have to take care of the lifestyle medication. It's the most important thing in the life. So first of all, like we have to take strategy as one-to-one, regular exercise of physical activities. So once the person go for a regular exercise or a physical activity, it makes the person heart stronger. So if the heart has to work more, then it can take care of the work less to pump. The force of the blood vessel will decrease and lower the blood pressure. In the other case, we are all aware that the age and weight gain are the two major risk factors for the high blood pressure. So if high blood pressure desirable level less than 120, then exercise can be prevent it from rising as your age. Other is a healthy diet. One should like go for a high potassium diet and a low sodium diet. Low people who used to sprinkle the salt above food, that should be avoided. It should be a low sodium diet and a high potassium diet. So your diet should include all those things which have high potassium instead of having a high sodium diet. There's a dash. One more thing we like it should be in our life is dash. It stands for dietary approach to stop hypertension diet. Eating this dash diet is that is rich in whole grains, fruits, vegetables, and low-fat dairy products or skim or saturated fat, and cholesterol can lower one's blood pressure by 11 mmHg if having a blood pressure. Along with, like if a person is having a dash diet, then it can control a blood pressure to 11 mmHg. Reduce sodium in diet. Like if we reduce the sodium in diet and have a healthy diet, then it could control up till the 5 to 6 mmHg of the blood pressure. Read food, like how can you came to know about that? Whether like product you are going to have a high sodium level or not. So it's good. You should go for a label of the can, like how much sodium content is there. Along with that, you should go for a eat fewer processed food. As the once we have to go and process the food, it contains a high sodium. So like if it's best to avoid a processed food, instead of that, we can go for a fresh food. And the major chunk of this is like don't add salt. Like some people have a habit of adding salts above the fruits or whatever the food they have. And the one more thing, quit smoking and limit the alcohol you drink. Alcohol, smoking is one of the worst scenario that is the most common in this lifestyle. So one should quit smoking, and that is going to control the blood pressure. And one more thing, regular blood pressure monitoring. Once a patient is on medication, one should be adhere to their medication. Along with that, regular blood pressure monitoring should be done. If it's a normal age, it doesn't mean that you have to stop the medication. like the blood pressure has been controlled with the help of a medication. So once you have to stop it, you have never to stop it. So once you go for consult with the doctor and adhere to the medications. Stress management, you have to take care of everything, like whether it's emotional or physical stress. You have to take care of everything. Like one of the major comorbidities for blood pressure or condition for a blood pressure is a stress. So we have to manage that. And the last but not least, adherence to the medication. Be regular follow-up with your doctor and adhere to the medications. That will be a beneficial thing for you, because one of the major cause of disease nephropathy is high blood pressure, and it increases a risk for ischemic heart disease. Ischemic heart disease when a patient having a myocardial infarction, heart attack, all those stuff. In a Latin language, you can call it heart attack. So one of the main causes blood pressure. It increases 20 times to mortality when it's related to the blood pressure. Thank you.